Imagine this. You eat healthy. Vegetables, nuts, grains, no fast food. But suddenly you start to notice. Your muscles twitch. Your sleep worsens. Your heart flutters. Your mood swings. And your focus disappears. You think, it's probably just stress. But what if it's not stress? What if it's magnesium? And not because you're eating too little, but because your body is losing or not absorbing what it gets. That's why it's important to understand not only how magnesium deficiency shows up, but why it happens. Today, we'll figure out why you might be deficient in magnesium, even when your diet looks perfect. I'll show you real medical mechanisms and research so you can understand where to look for the cause. When magnesium enters the body but isn't absorbed, sometimes the problem isn't that your diet lacks magnesium, it's that your body simply can't absorb it. This is especially common when the gastrointestinal tract isn't working properly. Here are the conditions where magnesium absorption suffers. Celiac disease, gluten intolerance, Crohn's disease and ulcerative colitis, irritable bowel syndrome with diarrhea, chronic pancreatitis, gastric or intestinal resection. In such cases, even a balanced diet doesn't help. Magnesium simply doesn't reach the cells. The American Journal of Kidney Diseases, 2024, review notes that malabsorption, that is, poor intestinal absorption, is one of the leading causes of magnesium deficiency. When food composition interferes with absorption. Sometimes the issue isn't illness but food combinations. Some compounds bind magnesium, making it less available. Phytates and oxalates, found in fiber-rich foods, bran, spinach, legumes, can reduce magnesium absorption by chelating metals. Phosphorus. High concentrations of phosphates in the intestinal lumen can reduce magnesium absorption by forming insoluble salts. Main sources of phosphorus include carbonated soft drinks, rich in phosphoric acid, meat products, and dairy foods, particularly cheddar cheese. Excessive calcium intake may reduce magnesium absorption. Dietary aluminum may contribute to magnesium deficiency and is widespread in cookware, deodorants, OTC, and prescription drugs, baking powders, and pastries. Low protein intake, more than 30 grams per day, may negatively affect magnesium absorption, although other studies show no consistent effect. Nielsen et al. Reported that taking zinc at 4 times the recommended daily intake for 90 days may decrease magnesium balance. When magnesium is lost. Now let's move to another scenario. When magnesium is absorbed but lost faster than it's replenished. Increased magnesium loss is a common but underestimated cause of deficiency. This occurs in kidney disease and tubular dysfunction. Alcohol abuse, mainly due to malnutrition, excessive urination, diarrhea, and vomiting caused by alcohol. Quoting the study, excessive alcohol consumption leads to hypomagnesemia in nearly all cases, varying in severity. Excessive sweating, in athletes during heat or with physical labor. Also in diabetes mellitus, where magnesium is lost in urine. It remains unclear whether magnesium deficiency is a cause or a consequence of this condition, as magnesium deficiency itself may contribute to insulin resistance and worsen type 2 diabetes. Stress. Cortisol increases renal magnesium excretion. Next, with certain medications. Diuretics, especially thiazide diuretics, as detailed in this article. Proton pump inhibitors, omeprazole, pantoprazole. A 2021 article noted that hypomagnesemia is often linked to the use of these common drugs. Magnesium loss is also observed with antibiotics, aminoglycosides, amphotericin B, whose effect may persist even after therapy, foscarnet and pentamidine, as well as cytostatics, cisplatin. Hypomagnesemia may persist for up to 6 years after discontinuation, and with immunosuppressants, which also enhance magnesium excretion, when magnesium metabolism and regulation are impaired. Now imagine another situation. Magnesium seems to be entering the body and not being lost, but still doesn't work as it should. Why? Here, the issue may not be quantity but regulation. How the body manages magnesium. Magnesium doesn't work alone. It's closely connected to other substances and hormones that help it function properly. For example, vitamin D. Without magnesium, it simply cannot be activated. Vitamin B6 helps magnesium enter cells and stay inside. Parathyroid hormone, PTH, regulates the balance between calcium and magnesium, keeping both minerals in harmony. Thyroid gland. In hyperthyroidism, metabolism accelerates, and magnesium is consumed faster. All this creates a situation where magnesium levels in the blood may appear normal, but tissues are deficient. That's why a blood test doesn't always reflect the real state, when the body simply needs more magnesium. Sometimes the problem isn't dysfunction, it's just that the body genuinely needs more magnesium. For example, during pregnancy and lactation, when part of the minerals go to support the baby's development, during periods of active growth in adolescence, during intense physical activity or marathon training, during recovery after illness or surgery, during chronic stress and sleep deprivation, when the systems that burn magnesium are overactive. Chronic magnesium deficiency is common in older adults, usually due to both reduced intake and impaired absorption, and it may be worsened by estrogen deficiency, as described in this article. In such cases, even a good diet may not fully cover the increased need. Why hidden deficiency is dangerous. You may not feel obvious symptoms, but chronic magnesium deficiency often shows up in small ways: fatigue, muscle twitches, eyelid tremor, sleep disturbance, anxiety, blood pressure fluctuations, or heart palpitations. If ignored, it can lead to cardiovascular problems, calcium metabolism disorders, and even osteoporosis. The Open Heart 2018 study showed that low magnesium levels are linked to increased cardiovascular risk. The Nutrients 2023 review states that even mild subclinical magnesium deficiency can cause chronic inflammation and increase the risk of cardiovascular and metabolic diseases. What to do? Assess your risk. Ask yourself, am I getting enough magnesium from food? Am I taking any medications that may cause magnesium loss? Do I have chronic gastrointestinal, kidney disease, or diabetes? Do I often experience stress or consume alcohol? Do I sweat excessively or train heavily? Get a blood test for magnesium. However, remember that serum magnesium tests can be useful but not always informative. Sometimes it's worth checking magnesium in urine or related markers, calcium, potassium, and vitamin D levels. Adjust accordingly. For example, in Spain, about 75% of the population consumes less than 80% of the national and European recommended daily magnesium intake. The recommended daily allowance, RDA, for magnesium, the minimum level to maintain health and prevent deficiency, is 400–420 milligrams per day for men and 310 to 320 milligrams per day for women. However, note that the tolerable upper intake level, UL, for magnesium from supplements and medications only, not including dietary magnesium, is 350 milligrams per day according to the U.S. National Academies, NASEM, and 250 milligrams per day according to the European Food Safety Authority, EFSA. Exceeding these doses can cause side effects, such as diarrhea. Choose magnesium supplements according to their form, since different forms have different absorption rates and effects. I explain this in another video. Check it out. It's worth it. Be sure to include in your diet green vegetables, nuts, legumes, whole grains, and dark chocolate. Minimize stress and alcohol, and address any conditions that reduce magnesium absorption or increase its excretion, as we discussed in this video. Conclusion. So if you feel tired, have muscle spasms, or trouble sleeping, don't rush to blame stress alone. Magnesium is the quiet hero of your metabolism, and its deficiency may stem not from diet, but from poor absorption, excessive losses, or increased demand. Be attentive to yourself, watch your body's signals, and make adjustments when necessary. And if this video was helpful, support the channel with a like and subscription so you don't miss new medical breakdowns. Take care of yourself and your minerals,